Now, today I will be going through the important books which are needed by the students who have recently qualified their NEET UG examinations, and I will be guiding them what to study for their first MBBS examinations, as well as having a long sight view of how to prepare for the rest of the examinations which they might be simultaneously considering, although it is a very early stage in their career, but the basic concept will help them in preparation of their NEET PG or USMLE or lab examinations or whatsoever examinations they wish to appear in the future. So to start with, I will be guiding them about the latest books which will be very helpful for them to prepare in the first MBBS. So as you are well aware that there are three subjects: anatomy, physiology, and biochemistry. So going sequentially, I will be just telling you what would aid you best in the preparation. So as far as anatomy is concerned, you have to remember that this anatomy as a subject is considered as one of the very major subjects, a very big, huge, vast subject with so many subtopics under it, and the most of the students would be spending 75 to 80% of the time in their first MBBS in anatomy only. The course is huge. The number of hours of study as far as the NMC criteria are concerned are dominated by anatomy, and that does not mean the other subjects, physiology and biochemistry, have a lesser value, but overall this subject is huge, vast, very much volatile, and that is a source of bit of a concern for many of the students. So as far as anatomy is concerned, it is a basic subject because you are getting the subjects in future like surgery, orthopedics, ENT, ops, gynae, and if you are good in anatomy, you can be good in those subjects as well. A very weak base in anatomy will cause its repercussions higher up, and you will not be able to grasp the subjects like general surgery, orthopedics, etc., what I have mentioned ahead. So what should we study with? As far as anatomy is concerned, you have to remember that anatomy has got many regions. So as far as the regions are concerned, you have the limbs, the upper limb, the lower limb, the thorax, the abdomen, the pelvis, the perineum, I mean to say, and very major topics like head and neck and neuroanatomy. So these various regions, almost there is a separate book for each of these regions, and what students mostly study from decades is the BDC, BD Churasya, and I personally am very much concerned that this book, especially the older editions, were very and much better than the previous I mean to say latest editions, because there has been a lot of addition of unnecessary material in BDC, but still BDC retains as a major book for the subjects which I have mentioned. So for regional anatomy, what we say, BD Churasya is a important book, and then you can go along with Gray's Anatomy for specific topics. I would not recommend reading at an undergraduate level for the students Gray's Anatomy as a whole, but BD Churasya and a combination of selected topics from Gray's Anatomy would do the best. So as far as the regional anatomy is concerned, we have this book, and you can go through the clinical scenarios, images of BDC, and that will cover much of your syllabus in anatomy as far as regional anatomy is concerned. Now, we have got the books, additional books, wherein it is very much imperative that good students read those books as well, especially the old edition of Richard Snell. I think that the old edition of Richard Snell is much better than the newer editions, because new authors, new editors, they just have got a different way of looking into the book, and they edit the book, but the basic older editions are far more better. The incorporation and additions and alterations by new authors, I am not completely satisfied with the way they have just mixed up the matter, their own matter and the old matter. But if you have old editions of Richard Snell, go to the library, get it and read from it, especially neuroanatomy Richard Snell. Then the histology, that means microanatomy, in which you see the microscopic structures. There is a very nice atlas, Dufour's atlas, time proven, and that gives you the minor and the major details of histology. So Richard Snell and Old Edition and DeForest's Histology are the two important books in edition. Now, in neuroanatomy and histology, some people read Inderbir Singh. Again, I would just recommend the older editions of I.B. Singh are far more better than the new editions of I.B. Singh. So selected topics from neuroanatomy and histology from Inderbir Singh. Then there is this osteology, a very, very important topic wherein you study the anatomy of the bones, the origin, insertion, muscles, attachments, nerve supply, and osteology is a very major subject, very much many marks in practicals, and Nafis Faruqi Osteology is one of the books which I would prescribe for the students who are doing osteology. Now, dissector, and you do a lot of time, you spend a lot of time in the dissection hall, and you need to have a guide for the dissector, and Grant's dissector is one dissector which is helpful for the students. That is important. So as far as anatomy is concerned, you have these important things. But sometimes what students do, they just miss what I am underlining over here is the surface anatomy and radiographic anatomy, and this forms a very important component of the practical examination. And most of the students, I have been an examiner to most of the colleges, and I find that students do not fare well, and this has got almost 20 to 25 marks as per the latest NMC criteria. And A. Halim. So Halim's surface anatomy and radiographic anatomy would be a book for this aspect of anatomy. So combining, we can take the help of books. You need not to get all the books. You can get the books from the libraries, but BDC, you should have your own, and DeForest Atlas, you should have your own. Rest of the books, you can go to the library, spend a lot of time in the library, and that would aid you in studying anatomy. Then how to study, that I will be giving the tips at last, but overall these are some of the books which I would like to mention as far as anatomy is concerned. Now, physiology is also a very important subject, and physiology deals with the basics of medicine, the physiological processes behind all the entities, and this is a very important subject for your having a strong base in medicine. Up till and unless your physiology is not strong, you will not do well in medicine. Take it in writing from me that most of the students who do not fare well, do not do well, do not study well in the first MBBS subjects, do not do well ahead. They get confused, they have a lot of things in mind, a lot of wrong concepts, a lot of missed topics, and they cannot do well. So physiology is the basis of medicine, and medicine happens to be a very important specialty and a major subject along with its subspecialties, and you will not do well if you do not study physiology well. So that's important. Now, what are the books which I would recommend? There's a book which is named as Guyton Hall, which is a very elaborate book, but with a bit of a repetition, and a student should know what not to repeat again. So you can go through Guyton, that is the basic book, and it is the cornerstone of reading physiology. Then there is this book Genong. So Genong is a book which is a bit of a condensed book, having a more concise and much smaller text, but the latest are given in there so that you can consult. In the previous days, we used to have Guyton and Genong as the two fundamental books, but lately there are some additions, Sembalingam and G.K. Paul. These are also very good books. In a very precise manner, they have given the points, and that's very important. So you can take help of Sembalingam and G.K. Paul. Now, for practicals, A.K. Jain is a practical notebook which is just for the physiology. So that is important. Now, as far as the other subject, the third cornerstone of first MBA is concerned, it is the biochemistry. So biochemistry happens to be a very, very important subject, very important for pediatrics and neonatology. Half of the pediatrics and neonatology is based on the biochemical faulty processes, and you need to know all the things which are in biochemistry for this thing. Though it's a minor subject, but a large chunk of questions in NEET PG are asked from biochemistry. So what are the books which we have for biochemistry? So very important. I would just say the best book for biochemistry as far as USMLE, NEET PG, MBBS is concerned is Lippincott. There is no other comparison to Lippincott as far as biochemistry is concerned. If you have not studied Lippincott, I think that you have not studied biochemistry. Then in addition to that, there are the books these are the reference books like Stryer and Leninger. You can go to library. There is no need for you to purchase these books, and you can take selected topics from Leninger and Stryer. So you can go through and select and ask your seniors what to study from Stryer and what to study from Leninger. Harper and Vasudevan is another book which is of, help. Harper, like Genong, happens to be a condensed book. Harper in Biochemistry and Genong in Physiology. And Vasudevan is also a good book which is simplified. So in Biochemistry, you have to read, cycles, flows, Krebs cycle, Cori cycle, glycolysis, glycogenolysis, all these pathways, and you have to memorize those things, metabolic processes, all those things in a very systemic manner. And you have to take help from, because one book cannot be sufficient for all. There are some topics given well in some books and some other topics given well in other books. So a better student and guidance from your seniors, good seniors, academically brilliant seniors, they can guide you well. So this is something about anatomy, biochemistry, and physiology. So these are some of the books. But here with a word of caution. So what happens? There are many books, a lot of study material available in the market, copied, copy pasted, copyright, violated matter, and students go here and there getting those notes, studying those notes, easy notes. There is no shortcut to success. Standard textbooks will guide you. They will remain with you forever. And if you have studied from the main standard textbooks, no social media, no Insta, no WhatsApp, no Telegram channels, trash matter available over there at nominal prices, and that's what has spoiled the concept of the students. And so aided by many educational institutions, I would not recommend that. Your best guide along the course of MBBS 5 years is the standard textbooks, and don't miss this point. So study conceptually. That is my advice to you. IBQs, wherever you find an image, you find a cycle, wherever you find anything, so go and have a remembrance of them, because many questions are image-based questions, and sometimes you are asked to draw image as well. No cramming, no shortcut to success. So these are the tips I would tell you. In addition to no to social media, no to Instagram, don't waste your time on these unnecessary YouTube channels, long videos, unnecessary videos. They are just for commercial purposes there. So in addition to that, I would just recommend you these things. This is the advice from me, and most of the students who just take a good advice, they do well. I wish you best of luck in your career. So that's it. Thanks a lot.